finished with Mina's sublative treatment, so we've taken care of the tone, texture, and now we're ready for a deeper approach in another way using the ePrime. And what that does is to insert needles deep into the reticulodermis, 1 to 2 millimeters below the skin, below the surface of the skin, and deliver the RF energy in a very precise way there. So now at the deeper layers into the reticulodermis, we can also stimulate some very nice collagen, elastin, and hyaluronic acid to be produced. So what that means is, over time, our body is naturally going to produce more volume, getting more thickness. You're going to get tightening, lifting, and a greater feel and elasticity of the skin. These impressive effects of the ePrime treatment actually give you younger skin, literally younger skin, at a molecular level. You're getting the elastin of a much younger person. You're getting the hyaluronic acid, which is a filler which people inject artificially, but now your skin's beginning to produce it on its own, along with the collagen that is the major component of skin aging, that there really isn't a great treatment for. This has been truly revolutionary. Gives you younger skin. Now we're going to give her a little additional anesthesia because as a more aggressive procedure, it's going to make her more comfortable. So we're going to go ahead with that now. We'll start with a nerve block, and then after that, she'll start to be numb through the most sensitive areas around the nose and mouth, and then we'll go ahead with our infiltrative anesthesia, and that'll allow us to get going, and she should be very comfortable throughout the entire procedure. Check 1.5 cc's of 2% lidocaine here. Very quickly, your mouth and upper lip are going to start to feel a little funny. So, as you can see, I've injected the infraorbital nerve. That'll numb the upper lip and this region of the face. Here, the mental nerve is going to get her lower lip in this region of her face. We still do want to follow it with an infiltrative anesthesia, because then we can deliver epinephrine, which will help cut down on bleeding and bruising. We're going to infiltrate with a dilute lidocaine and epinephrine. What that does is to get her completely numb, completely comfortable. We're going to go actually very high. We're going to go right up close to her eye, because what we're finding is that we get nice tightening around the eyes and a nice lift of the cheek, coming all the way up into the temples. We get that lift all the way through. And these are things that used to only be possible with fillers, Jupiter and Restylane and Sculptra. And now we can get the body to produce those same things, that hyaluronic acid, but also elastin, also collagen, things that are going to make normal skin, normal young skin, and give you that lift with the entire face. Also going to continue the treatment pretty far down on the neck. And when we do that, we can avoid the loose skin on the neck and underneath the chin as well. We're going to do full treatment all the way down through our entire neck. So leading our anesthesia with nerve blocks makes these injections incredibly comfortable. Now that Mina's nice and numb, we're ready to proceed with the ePrime part of the procedure. The precision of this machine is really built into the device. So we control the temperature that we're going to get the tissue to, and the time that we're going to hold it at that temperature. So 67 degrees at 4 seconds works very well. It gives some very nice tightening, volume, and that's what we're going to be using today. Okay, so we're doing okay? Very good. And with this anesthesia, this tends to be a very comfortable procedure. She will have a lot of swelling after the procedure. That's normal over the first 2 to 3 days. It's better very quickly. By a week, she should be pretty well back to normal. Surprisingly, or pleasantly, patients really don't describe any pain at all associated with that swelling. So she should be in for really dramatic results. We've got a lot more to do here, but typical treatment takes about an hour, and we're doing about 400 to 500 pulses for a full treatment of the face and the neck. But that gives really dramatic results. There's tightening and volume and elasticity.